Welcome to the JOMA Preventative Health Podcast, hosted by the Jewish Orthodox Women's Medical Association. We provide you with up-to-date information on health topics geared towards the Orthodox Jewish community. This podcast content is provided for informational purposes only and is not intended as medical advice or as a substitute for the medical advice of a physician.
Hi everyone, my name is Afrat Brook. I am the director of JOMA Pre-Med. I am a former high school teacher and MCAT content creator for Khan Academy. I graduated from the Icahn School of Medicine at Mount Sinai, and right now I'm an anesthesiology resident at the Mount Sinai Hospital in New York City. Our Specialty Spotlight series is geared towards pre-meds and medical students and gives us an opportunity to interview physicians with interesting career trajectories. So we have a really special guest with us today, Dr. Richard Harris, which I would like to introduce. Dr. Harris attended St. Peter's College in Adelaide, South Australia, and then completed his Bachelor's of Medicine and Bachelor's of Surgery at Flinders University. He subsequently completed his anesthesiology training in the UK and New Zealand. In addition to practicing as an anesthesiologist, Dr. Harris has worked in diving and aviation medicine around the world. His passion for cave diving goes back to the 1980s and has taken him to the corners of the globe in search of new adventures. Dr. Harris and his colleagues have explored caves at a depth of 245 meters and shipwrecks at a depth of 150 meters in dives lasting over 16 hours. He is an enthusiastic underwater photographer and videographer and is now also building a career in documentary films. Dr. Harris has a professional and voluntary interest in search and rescue operations and established the first sump rescue course in Australasia. By building relationships with emergency services locally, he has been preparing for such an event. In 2018, combining his expertise in anesthesiology and cave diving, Dr. Harris played a critical role in orchestrating the rescue of a soccer team and their coach from the Tham Luang Cave in Thailand. In 2019, Dr. Harris was named Australian of the Year in recognition of this incredible rescue. He is the recipient of numerous other prestigious awards as well, such as the Star of Courage and Medal of the Order of Australia. Dr. Harris and his colleague Dr. Chalin published a book, Against All Odds, documenting the Thailand cave rescue. Dr. Harris, it's an honor to have you with us here today.
Thanks, Efrat. It's nice to be here, and thank you for that very long and impressive introduction. It makes me realize, just how busy I've been.
Yeah, that's great. So I'm really excited about this interview. And one reason is that so much of what we do at JOMA Pre-Med is provide our pre-meds with sort of like the technical and practical support of getting to medical school, like what do you need to know and PowerPoints and charts and support. But I feel like this interview is an opportunity to sort of hear a more inspiring story and hear more of a story and sort of more like the art that goes behind medicine, not just like the technicalities of it. And then another reason is one of the things I'm trying to do with JOMA Pre-Med is not just help people become physicians, but like physicians plus. So I want people to feel like they can take the skills that they get on their journey to becoming a physician and do other things like, entrepreneurs, activists, leaders in their communities. So I think you are the perfect person to interview to help us accomplish that goal.
Oh, thank you. Yeah, it's funny you say talk about the art of medicine, because I think that nowhere does that apply more than in anesthesiology. Obviously you have to learn the nuts and bolts of it. But when you start dealing with patients as an anaesthetist, and I'm sorry, I'm going to say anaesthetist because that's what we call ourselves in Australia.
Yeah, it's okay.
The art of anesthesia becomes actually more important in many ways than the science behind it. So it is an art form.
Yeah, absolutely. So I'm going to jump right into the questions because I'm really excited to hear your answers. So the first question is, can you tell us a little bit about your background and what made you decide to become a physician?
Well, it's a good question. Actually, when I was at high school, I was very undecided about what my future held. I knew it was something to do with biology, science, that kind of bent. My creative brain was very underdeveloped at that age. Can't play an instrument, can't sing, and can't dance. That's for sure. So I knew it had to be something in the sciences. And diving was always a big part of my life, even as a young teenager or earlier, actually. And so marine biology, I thought, was the thing for me. But I got talking to some people who said that there was a lot of problems with employment in that in that field.
Mm.
So I started to think about being a veterinarian or a doctor. And actually, some people are a bit horrified to learn that my grades at high school were just short of doing veterinary science. So I had to be a doctor instead. So not smart enough to treat dogs, but smart enough apparently to be a physician. So that was the final decision point. But as it turns out, that the field of medicine has been absolutely perfect for me, and in particular anesthesia and all the other disciplines that fall under that massive umbrella of anesthesia and critical care have really worked very well for me, particularly given I've got so many interests outside of medicine or that work well alongside of medicine. So yeah, it's been a great career for me.
Yeah, that's really great to hear because I think one of the fears that we hear a lot with pre-meds, and I think it's a very legitimate fear, at least with how training works in the U.S., is that people really feel like they're going to lose themselves during training. Like the years are long and it's really competitive, and you have to do all these extra things to get in. So I'm really glad to hear that like you're able to integrate the rest of your life with being a doctor. Maybe it
And
was
not
harder during training, but
Yeah, I mean, not only can you, I
get
think
there.
it's essential. It's essential to, because so many of us in medicine, so many of my friends and colleagues, and you'll be seeing this already, get so caught up in their vocation as physicians and clinicians that you actually forget to firstly have an interest outside of medicine. But more importantly, that means you don't look after yourself, and it is crucial to be married to more than your job. You need to have some way of de-stressing and finding a world outside of the hospital. And you should, when you're a medical student or training for your specialist exams, it's very easy to lose sight of that because you have to be 110% committed to get through all those obstacles. But just remember to keep a small part of your life, even in those very difficult and busy times of your life, for something else that's unrelated. It doesn't have to be cave diving or spending time underwater, but whether it's playing an instrument or socializing or interpretive dance, whatever's your thing, just make sure you have a little room in your life for something else.
Yeah, yeah, I'm so glad you said that. There's a lot of talk right now about again in the US certainly, I don't know about the rest of the world, but there's talk about like burnout and I don't know, there was an article recently about like there's going to be some massive exodus from healthcare in the US. I mean, who knows what's going to happen, but I think you bring up a really critical point. So thank you for that. So on to the next question. Can you point to anything in particular that made you choose to be an anesthesiologist over another type of specialist? And which character traits do you think are most important for an anesthesiologist to have?
Yeah, there was definitely a moment when I realized that anesthesia was going to be my thing. And actually, I started out on the path of general practice or family medicine, and I wanted to work in rural and remote areas because I'm a fairly
Mm.
practical person, and I thought that to be able to do a little anesthesia, a little obstetrics, a little surgery in a remote area would really satisfy my practical bent, as well as my interest in talking to people and communicating with my patients. So I went off to the United Kingdom to do 12 months of anesthesia and did their diploma exam over there in the early 90s, which was a very practical introduction to anesthesia. It's like a mini fellowship, a mini board
Mm.
certification in that specialty. It very much focuses on the safe and practical provision of anesthesia. And at the end of that year, I thought, well, I really, really have enjoyed this. And I did quite a lot of intensive care, worked in, different hospitals doing different stuff, and thought, whilst I was never a massive fan of pharmacology and physiology while I was at university, seeing that practical application, and in anesthesia and critical care, as you know, you see it on the end of the needle. You see
It's
the
real
effect of
time
your,
medicine,
yeah, it's like,
I call it.
if I'm going to prescribe an antihypertensive to someone and I have to see them in 3 months to see the benefit or the effect, I don't think I'm going to be happy with that. But you give an alpha blocker to someone and you go, whoops, too
Yeah.
much. That really works, that stuff. So I enjoyed that practical application of physiology and pharmacology. And if you enjoy it, then you can get into it. If it's dry and tedious, then it's just something to be endured and passed and move on to the next thing. So I realized that was a thing for me. And it's also a very practical discipline in medicine. You get to poke people and do fun things,
Yeah.
which I do enjoy. I would have liked to have done surgery, but to be honest, the ability to walk out of the hospital at the end of the day and leave my patients behind was also very attractive to me, rather than being on call every day of the year when you've got a patient in the hospital still,
How are they
which
gonna
is
call
surgery.
you for something if you're down in the cave?
Exactly. You read my mind. So I needed to have a little bit of me time, and I think that anesthesia was able to provide that for me. So it seemed like a very obvious path. And as I mentioned, anesthesia lends itself to other disciplines. So critical care medicine, working in trauma rooms, resus rooms, working in aeromedical medicine, which I got involved with, which is a little bit different in Australia to the US model. We have a lot of physician based teams going out on the road with paramedics, or flying out to road accidents and so forth with paramedics and
Mm,
nurses. So, because we have such remote areas in South Australia in particular, there is often a need to take the physician to the patient to start to work on them and stabilise them to bring them back to a teaching hospital. So I've done quite a lot of that, and diving and hyperbaric medicine, obviously physics, gases, and scuba diving all wrapped into one. It suits anesthesia very very well as well. So yeah, lots of opportunities for doing different things.
yeah, that's great. And what do you think are like the character traits that are, most salient or most important for anesthesiologists to have?
Well, I mentioned before when I noticed that that picture behind me was a little bit crooked. A little bit of OCD is good, I think.
A little?
Look,
Maybe more than a little. Yeah.
everyone in medicine has a touch of it, but
Yeah.
there are some specialties that require a little more. And I think being careful, well prepared, using checklists, all those things lend itself to interventions that can be time critical, and you want to be well prepared for them. And actually, scuba diving in the way I do it, cave diving, technical diving as we call it, requires a lot of attention to that same detail, a lot of use of checklists and things to make sure that you're safe when you venture deep underground or underwater. So I see a lot of similarities between my passion and my vocation. So yeah, I think that's an important trait. Being calm under pressure obviously is important again for both those disciplines, and enjoying a little bit of that high pressure work. So, I mean, people are self selected for different specialties in medicine. If you don't enjoy, sometimes working with patients who are critically unwell, then you probably won't, persist with that kind of specialty. Similarly, if you don't want to sit in a chair talking for an hour to each of your patients, you probably won't persist in that kind of specialty. So you find your place.
Yeah, I think it's interesting that you're saying that because when I initially came into medical school, I wanted to be a nephrologist because I had a brother who was sick, like with kidney disease from when he was born, and I did, nephrology research. So like I come into medical school, like, sure, I'm going to be a nephrologist, and like, I do 3 months of medicine, and I'm like, I can't do this. Like, I need something a little more pressure, a little more intensity, a little more, real time. And I'm happy with my decision. So hope it stays that way.
Yes, well, and as you can see, there's lots of different avenues for you to
Yeah.
pursue within those specialties. So, yeah, you'll find your thing.
Yeah. Yeah, hopefully. So what would you say is your favorite part of being an anesthesiologist, and what is your least favorite part of being an anesthesiologist?
My favorite part is definitely that moment that you have to, that very short period of time that you have to connect with your patient and make them comfortable and reassured that they're in safe hands. And I sometimes at a cost, but usually successfully, have used humor a lot to do that. And but you have to be careful, obviously, with humor,
Yeah.
because occasionally
Yeah.
you get it wrong and it doesn't go well. But I do enjoy that sometimes 5 minutes that you have with a patient if they're having a straightforward, simple elective procedure, to just communicate with them in a way that makes them realize, okay, this guy's all right. He's going to look after me. And we hear this constantly in medicine, but this is a routine day at the office for us. But often that is this patient's most frightening day of their life, even though it might seem a very simple, straightforward thing for us. And it's a very privileged position that we're in to have that moment with them. And I have to constantly remind myself that this might be the number 10 patient for the day, but they are just as frightened as number one was. And we need to work very hard to instill that confidence and really give them the care that they provide. So I think that's my favourite part of anaesthesia, and I especially love doing that with kids, especially when that goes well. Again, not so much when it doesn't go to plan A, but there's always plan B for kids with the can just get on with it.
Yeah.
But it's a great feeling of success when you actually get a child on board and you get them involved and you make it fun, and they wake up not really remembering that moment when you outsmarted them and they were asleep. So that's good fun, and it's great when the parents there, of course, and they see that happening as well, and know that their child's safe and went to sleep happy. It's pretty awful when they go to sleep distressed, and sometimes that's out of our control. But yeah, that's what I love about it. What do I hate about it? Well, like any job, it can keep you out of home for many hours of the day and weeks. So it's hard, and there is that responsibility that we feel for our patients. And the things I love about anaesthesia, seeing that the change in physiology at the end of the needle, also is the thing that is scary about it, of course,
Yeah.
because sometimes things are not going well. And the times I'm most frightened in that setting is when things are going badly and I'm not sure why. And you've run through your little mental checklists and differentials, and you've come up without a clear answer as to why this patient's not behaving as they should, and that can be very frightening. And the more junior you are, the more frightening that can be. But of course, the more help that's around as well. So sometimes when you're a consultant, then you are kind of by yourself, and you have to try and sort these things out. And our worst nightmare for any kind of clinician is to injure our patients, or for them to have a bad outcome, and potentially for us to have missed something or made a mistake. So that's the challenge of any kind of medicine, I think, and we all have to be able to deal with that.
Yeah. Yeah. Thank you. That was an incredible answer. And I think I agree with 100% of it. Um, can you talk a little bit about how you became a professional cave diver? I mean, you mentioned earlier that you started diving when you were a teenager. So if you can tell us about that process and like who are your mentors and like who taught you how to do this?
Yeah, it's a good question. I grew up in a family that spent a lot of time over summer in small boats and mucking around in the ocean, and a bit of fishing and a bit of snorkeling and that sort of thing. So that was my childhood memories, between 5 and 10 years old. And I met a guy who was the father of a friend of my sister's, who had one leg, and he was a very big, strong man. He was honestly just like a pirate. This great big man he actually had a wooden leg, like a peg leg, like a pirate, and he would often dress up and put a patch on his eye when he was around kids. So he was a very daunting figure,
That's
slightly
nice.
scary, but slightly amazing, to a young boy. And he was a professional diver, and he ran one of the first diving shops in Adelaide, where I'm from in South Australia. And so I became kind of wanting to be like this man, and maybe that's where my interest in marine biology started. So I started knocking on the dive shop door when I was about 12, saying, I want to come in and do a dive course, and they would turn me away and say, you're too small. This was in the 70s. And finally, when I was 15, they let me do my dive course, and I just, I loved it thereafter. When I was at university, I became a diving instructor in the diving club. And after a while, a few of us were thinking it's getting a little bit boring just diving around our local sites. And we're very lucky that, a bit like in Florida, we have an area that is full of sinkholes and caves, limestone caves filled with water. So a bunch of us went down there in about 1986 and did a cave diving course. And to be honest, initially I didn't really love it. It was winter in Adelaide. It's it's not particularly good weather, and it was raining, and I had a cheap old wetsuit, so I was very cold. And in cave diving training, you don't actually get to see a lot, because half the time you spend blindfolded underwater, and they keep pulling the regulator out of your mouth.
Mm.
It's a very tough bit of training, and the training is designed that way so that if you do have a problem underwater in a cave, which is a potentially dangerous environment, then you are prepared for it. So I came away from that thinking, cave diving, I don't really know if I like it. But I didn't do a great deal after that until the year 2000, when I went back and visited just one of the caves, and it was absolutely perfect day. the sun was shining down into this crystal clear water through the entrance. And I just did a little shallow dive there, and I thought, wow, this is absolutely beautiful. And I just threw myself back into it. I found a bunch of people who were very senior, very much more experienced in it than I was, and they were explorers. And I hadn't really come across this part of the cave diving community before, people that would actually go out and find new caves that were unexplored and lay line in them. So we always run a piece of string basically through the cave so that we can find our way back out again. And these guys were traveling around the world, finding new caves and exploring them and mapping them and taking photos and videos. And I suddenly realized this is what I want to do with all my spare time. And yeah, it's proved to be an extraordinary 23 years or so since then that I've been really pursuing that passion, and in particular taking images underwater and video is my particular interest. And that's what's led me now to this opportunity to make some documentaries that I'm working on.
Wow, that's incredible. So like as you're saying this, I'm thinking back to when I was a teenager. Were your parents okay with this? Or
My parents, yeah, well, they encouraged me to have an outdoor life and to seek adventure. And I guess as a teenager into my early 20s, the male brain doesn't develop too fast. And I think in my case, it was especially slow. So, I was a bit wild probably at that age, and got into a bit of trouble here and there. So life wasn't all smooth sailing for me, and university was a bit of a shock to me. And again, my first year at university did not go very well at all because I was quite distracted by a lot of other stuff. Um, and so definitely not the model medical student. And these days, I wouldn't have stood a chance, if I'm perfectly honest, to survive in the very competitive environment that you guys have to deal with. So I was kind of lucky to be starting medicine in the early 80s, where a little bit of misbehavior was tolerated. So anyway, obviously I turned
wow.
out okay. I don't want to think
I think so. I
don't
mean,
want you to
does
think
it
I was a
matter
terrible
today?
fellow, but yeah, it was a bit of a shaky start in life. So my parents had enough to
That's
worry about. I
great.
think probably cave diving was one of the lesser evils of what I was trying to get up to. So
Yeah,
yeah,
that's
life
great. I
wasn't.
mean, I'm just thinking like I certainly did things my parents wouldn't approve of, but like I would probably have to hide something like that from my parents. I mean, I remember my mother panicking when like I wanted to go on the Ferris wheel in the amusement park. So I guess like different strokes for different folks, but that's great that like you're able to do that and your parents were encouraging. I think that's awesome.
Well,
Um,
just on that note, one of my big agendas is that young people, in fact, old people as well, to be honest, but young people need to be able to take well managed risks in life, because risk taking is a normal part of the human condition, and we don't develop normally if we don't push our limits and our boundaries. Now, that doesn't have to be as an adventure or in a physically risk taking way, but the old there's plenty of cliches around this, but what doesn't kill you makes you stronger is to a
yeah,
large degree very true, in my opinion. Obviously, there are things that are damaging to people, especially the young people, and with trauma and so forth. But it is very important that we let young people explore their physical and geographical limits without smothering them too much. I really worry about people who have had this sort of perfect life that in Western culture we often can be exposed to. And then the first time that they fail at an exam or a job interview, their world comes crashing down. And, I think that's at least partly responsible for this mental health epidemic that we're seeing. Everyone's so driven, so competitive. And in medical school, it's like this petri dish of
yeah.
pressure and expectation that I wish we could just relax a bit and enjoy medical
Yeah.
school, because it should be a great time of your life.
Yeah, I mean, I'm taking notes because, my kids are still young, but I'm sort of like listening and like maybe I'll pick your brain about this another time, like the
Yeah.
managed risk taking. But I'm one of 10. So like I always say, like, I don't know, I'm not sure who raised. I mean, of course, my parents raised us, but like there's a lot of risk involved in our upbringing just because of the nature of, having 9 siblings. But the Ferris wheel was like out of bounds. I don't know why. Getting to like the part about the Thailand cave rescue that I'm really interested in hearing about. Can you describe how your training as an anesthesiologist helped you orchestrate that rescue. And then, while we are gearing this for pre-meds and medical students, can you talk a little bit about the anesthetics and drugs that were used, and like the thought process behind those drugs? So, I mean, I sort of read about it, but I think it would be cool to hear from you a little bit about the thought process and what went into coming up with that plan.
I think the first thing to say is that my whole life really was preparation for this moment in the cave in Thailand, and neither my skills as an anesthesiologist alone or my life as an adventurer and particularly a cave diver could have prepared me for what I was faced with in Thailand. And I was incredibly fortunate to have had this sort of this coming together of a number of skill sets or life experiences even that just helped put me in the right place at the right time in the right mental state to be able to go through with what was a completely ridiculous and audacious plan that I personally felt had zero chance of succeeding.
Really,
Yeah.
you didn't think it would
No, I
succeed?
mean, so basically, to put that all together, so I've spent the last 30 years or something cave diving. I've got a particular interest in cave rescue, and I'd actually been running a course in Australia and New Zealand on how to potentially extricate someone through a flooded cave. To bring them back to the entrance had they suffered some kind of injury or medical event. And of course, I was being slightly selfish when I went into this because I thought, well, that might be me one day or one of my friends. And if we break a leg or have a heart attack, I'm 58 now, that could happen any moment. I thought, we better have a plan how to get someone through the water back to the entrance. And some of the caves we dive can be several miles underwater. So I've been working on that. And then when I heard that these kids were stuck in the cave in Thailand, the cave diving community globally is quite small. People will be surprised to know that it's not the most popular sport in the world. I can't understand why, but at the kind of exploration level, there's only less than 1,000 people who do it, and at the really pointy end, maybe a few hundred around the world who are right into it. So we kind of know each other to some degree. And when the two British guys and also some expat cave divers who lived in Thailand got involved, I just heard their names coming up in the media, and so I started to reach out to them as old friends or expedition friends. If you need some more help, I've got a group of divers here in Australia who have had some training. Maybe there's something we had to offer. And it was actually Rick Stanton, one of the British divers, one of the two guys who first found the boys on at the end of day 9 when these boys had been trapped 2.5 kilometres, whatever that is in miles, into the cave, and about 1 kilometre of that was completely submerged, broken into different sections. So they finally broke through into this chamber where the boys were sitting up on a very high bank on a flat bit of mud. Found the 13 boys, were amazed that they were all alive. Everyone had expected that they'd long since drowned or perished in the cave by then. And then they came out and thought, well, finding them is one thing, but how on earth are we going to bring these children out of the cave? At that time, we were told the kids couldn't swim. That proved not to be the case. But, if you can't even swim, let alone scuba dive, there's no chance you can teach people to cave dive in, the time we had available to us, particularly given the difficulty of this particular cave. I mean, it was it had actively flooded, so the flow was very strong. The visibility in the water was literally zero. It was like swimming through, chocolate milk or coffee. You couldn't see your hand in
Wow.
front of your face, so everything was being done by feel. The British guys and some other divers had laid rope all the way through the cave so that at least we could just feel our way along the rope as we went through. But you're constantly banging your head and, having to pull yourself through holes that you could only feel, you couldn't see them. So it was very difficult diving, even for experienced cave divers. So there was zero possibility of teaching these children to safely dive without them panicking. And panicking divers underwater essentially drown, and not only just drown themselves, but they often drown someone who's with them in their, in their panic.
Can I pause you for a second? And they drown because
Um,
why?
well, literally because of panic. I've
Okay.
been involved in quite a lot of accident fatalities and investigations, and it's not uncommon to find a diver who still has air in their scuba tank, but they have for some reason drowned, and often the
Okay.
reason is that they have panicked. As soon as you panic, you lose all control, all ability to think rationally, to make sensible decisions, and to look after
Yeah.
yourself. And seems like a common response that people reach up and pull the regulator out because they feel they can't get enough air because they're breathing
Like the
so
little
hard.
kid that you're trying to put to sleep, right? Who's trying to rip the
Exactly.
mask off the
Yeah.
face. It's like a
So they pull their
primal.
regulator out or rip their mask off. They've got
Yeah.
that feeling of claustrophobia. They're panicking. They feel like they're drowning, and then they actually do. And it's pretty sad to see someone who's still got an hour's left of air supply who has drowned because they've
Yeah.
lost control. And that's even more common in caves because of that, overwhelming sense of panic and fear that people naturally have, underground, underwater, with a finite gas supply. So it was Rick Stanton, having found these kids, who started to think, well, how can we possibly get them out? The forecast, the meteorologists were telling us we had 3 to 5 days before the monsoons would return. The cave was completely undivable when the rains first started because of the power of the water coming out. So we knew that once the monsoons returned, there'd be no more diving. We couldn't keep them in the cave until the monsoon dissipated because the conditions in the cave were starting to deteriorate. The oxygen level in the chamber they were existing in had dropped down to around 15% already. So they were already, starting to potentially be at risk from hypoxia. They had no food. They hadn't eaten at all for the first 9 days because they didn't take any food in with them. And so the amount of food that could be taken in to the boys was very small, only really what the divers could take in. So there was certainly no way of sustaining them for what could be 3 or 4 months until the monsoons finished. And finally, the environment in there itself was deteriorating. It was becoming very toxic, with all their urine and feces and so forth. So, by the time I got in there, the smell was overpowering, and it was only a matter of time before they started to get gastro or skin infections or chest infections. In fact, a couple of the kids I could hear were coughing and already starting to sound a bit sick. So, really we had to do something. And it came down to this very binary decision of either we try this anesthesia plan that Rick Stanton had thought of and asked me to contemplate, or we leave them there to die. Now, to go back to the sort of technical aspects of the anesthesia, I've worked a lot in developing countries. I've worked at the roadside and obviously in the hospitals. Ketamine is a drug that is finding more and more favour as time goes on. The indications for it seem to be expanding by the minute. But in critical care medicine, it's a very common induction agent for anaesthesia for patients going onto a ventilator in intensive care. Obviously, for hemorrhaging or profoundly shocked patients, it's a very good choice for an induction agent because of its sympathomimetic effects. And the best thing about it, especially in the developing country where airway intervention is often not possible, is that patients will maintain their respiration and a degree of airway protection as well, as well as maintain blood pressure and so forth. So for kids who are going to be underwater, essentially there was no other drug which was on my radar. They had to be able to breathe by themselves. We were going to put a full face mask on so it would seal all the way around their face, so their airway in theory would be kept dry. But, no doubt a little bit of saliva or water would get into their airway at some stage. And as you know, young people have a much stronger tendency for laryngospasm and bronchospasm if that occurs. So, I wanted them to have the most protection of their airway possible without putting in laryngeal mask airways or any other instrumentation. I wanted them to keep breathing, and I wanted them to maintain normal blood pressure, because the other thing is I wasn't going to be able to anaesthetize these kids and take them all the way out myself. I was going to have to hand them off to the British divers to take out of the cave. Now, that dive was going to take about 3 hours for each boy, and the ketamine was not going to last for 3 hours. So they were going to need top-up injections, and that was going to have to be done by lay people. So what other drug is there that you can give as an intramuscular injection, basically stick it in to somebody anywhere you can, and it
Yeah.
will work. So I taught the British divers just to give an intramuscular injection into the outer thigh, and I preloaded the syringes with all the doses for them, and said essentially, if the boy feels like he's starting to wriggle or moan or wake up in any way, just stop and give him another injection in the leg. My greatest fear was, apart from the boys themselves, was that they would wake up in the middle of the dive and panic and drown themselves and the British diver, which I felt was a very, very real risk. So that was the recipe. And, I'd given a lot of ketamine during my career, but I'd given very little intramuscular ketamine, and I'd never maintained an anesthetic with repeated doses of intramuscular ketamine. In fact, I couldn't find any references in the literature really to that at all. So I really was out on a limb, not knowing how to go about this. So it was very much back to first principles. And that's where a life of, being in unusual environments, doing unusual things, and having worked in medicine in lots of different environments really enabled me to have the courage to, just back myself and trust that my instincts about this would be correct. So yeah, each of the doses of ketamine lasted, as we predicted, about 3/4 of an hour. The subsequent top-ups were easily managed by the very courageous cave divers who had to give them. I mean, these guys had never even given an injection before, let alone an anesthetic. So it's hard to
Wow.
imagine how frightening that must have been for those guys. And the kids did exactly as they should have. They kept breathing mostly. There was I don't want to say it was smooth sailing. There were a few near misses. But they all came out alive and intact, and it's a very good advertisement for ketamine in emergency settings. Yeah, you'd have to say.
Wow. Wow. I'm just like digesting some of that. That's incredible. Um,
I mean,
on to some, yeah.
to tell you perhaps about the reason why I was so pessimistic about the outcome. I don't think you have to be an anesthesiologist or a cave diver to suggest that, if you're going to render someone unconscious for what
Yeah.
will be a 3-hour dive through the water, and then push these boys underwater, and then 3 hours later they'll appear
Yeah.
at the other end, the chances of them still being alive surely are,
Yeah.
very, very remote. And the main three things I was worried about was that the mask would fill with water and they would drown inside the mask. And, I've used these masks quite a lot in different commercial diving and other applications, and they do get water in them.
Yeah.
I was very worried about that. I was worried that they would just simply lose their airway because of their head position at some stage. These people looking after them aren't trained in airway management, so it's not
Yeah.
hard for an airway just to obstruct at some point during 3 hours, and
Yeah. You
they
can't exactly give a
suffocate.
jaw thrust as you're,
Well,
I don't
exactly,
know,
yeah.
pulling pulling a kid through mud water. Wow.
And then the final
Uh,
thing was that if those things didn't kill these kids, then surely they'll die of hypothermia, given what we know about anesthesia, lowering core temperature or making you more susceptible to heat loss. And again, ketamine just worked in my favour for all of those issues. They were thin kids, perfect airways. They were lying prone the whole time, so secretions and water were draining away from their airways. They weren't obese kids with reflux, so they didn't have a beard or sleep apnea, all the things we worry about, which would, raise concerns in any sort of anaesthetic situation. And finally, I think the sympathomimetic action of the ketamine caused some vasoconstriction in their skin and prevented excessive heat loss, although they were still cold when they came out, but not life-threateningly cold. So, yeah, we're very lucky.
wow. Wow. I'm just a little stunned. Moving on to some more questions about the rescue. As physicians, we often face stressful times, and I'm sure in the days leading up to the rescue, you kind of felt the eyes of the whole world sort of on you metaphorically. In my mind, like in a microscopic way, like I'm thinking of like when I'm in a, doing like a spinal or epidural and like there's 20 people in the room and here's a chance for everyone to just like watch the anesthesia resident do it, right? And like that, kind of stress you feel. So, you have that on a, you know, orders and magnitudes higher. How did you deal with that stress and not let that interfere with your function?
Yeah, I mean, I'd like to say I was just very courageous, but actually nothing was further from the truth. To be honest, we didn't realize the size of this story globally at the time, and I think that was very lucky for us. We were very isolated. We were an autonomous little group of cavers at the far end of the cave with really no one watching us, obviously. Only the four British cave divers and myself went to the far end of the cave each day. So it was really just us and these kids. And I I think that when you've worked for a long time in this kind of medicine, you're able to deal with the patient in front of you who may be in serious trouble, and just put them into that work box, in your mind, and say, this is the patient in front of me. I just need to give them my full attention, do the best I possibly can for them. That their life is at great risk at the moment, and it's my job to do the best I can to avoid that as an outcome. And then you can't think about the waiting room full of kids sitting up the hill. Like when you work in the emergency department, you can't think of what's outside the door, that sea of humanity that's out there waiting for you, which will never go away, and you can never kind of make an impact on it. You just got to look after the person in front of you at the time. And I think that's the way you deal with any difficult situation in life, let alone medicine. Just it's like, how do you eat an elephant? One bite at a time is the only approach. So yeah, I didn't really feel that pressure on me. What I did feel was, grave concern for each of these boys, and I certainly felt that, the thing that affected me psychologically perhaps was this sense that I was doing something very wrong, very amoral, ethically completely off piste. If to be honest, I felt like I was euthanizing those kids, and that was almost a conscious decision that I'd made, because in my mind the alternative was so much worse for them. I had this choice: either I give this a try, thinking that actually each of those children will die from the anesthetic, or I get on a plane and go back to Australia knowing that those children will definitely still die, but it will take a couple of weeks, for them to perish from
Mm.
starvation or illness, or let alone the psychological impact on those boys, realizing that no one was coming back the next day to help them, and they were just going to sit in that cave until they starved or whatever. So I just couldn't do that, and I think it's easier on many occasions to do something than to do nothing, however awful that something is. Positive action and making a decision to proceed with something just gives you something to do, and it's a lot easier than sitting back and watching something worse unfold. But I did struggle a bit with the fact that I was doing something, very experimental, and I was questioning what right did I have to take on that responsibility personally. There were a lot of moral issues around this for me. I mean, I never spoke to the parents. I certainly did not get any kind of consent from the parents. The Thai government um, didn't ask or offer the opportunity for that to happen. And to be honest, again, I was quite relieved that that was the case, because what was I going to say to the parents of all these kids? If I try this, I think your sons will die. If I don't, I think your sons will die. What do you want me to do? And what parent can possibly make a decision about that? And I know that's very paternalistic kind of approach in many ways, but sometimes in these sort of situations, that style of medicine, which we frown upon so much in modern times, actually can prove to be effective, because sometimes it can resolve an impossible situation. And we could discuss the philosophy of all this for the whole podcast, I'm sure, and maybe it's something you should do with your classmates and your
Yeah.
colleagues, to talk about. But it is an interesting conundrum, and maybe it'd be a good day for the medical students to sort of wade through this. And I'd love to be a fly on the wall and hear what they decide is the
Yeah.
best way forwards.
Yeah, we actually have a lot of people at the organization who like this is their area of interest, medical ethics, and I didn't even think of that. Like you never spoke to the parent, like right? There was never a formal like we never do anything without a formal process of consent. And yeah, that's a really interesting topic.
Yeah,
Um,
it was tricky. And, there are other moral dilemmas that cropped up. Like, what was I
yeah,
going to say to the boys on the second day if all their friends had died on the first day? How was I going to cope with that myself?
yeah,
And fortunately, I had my friend Craig there who I was able to talk this stuff through with before we went in. And we decided that I was just going to have to lie to them. I mean, how could I possibly go in there and say, I'm sorry, all your mates are
yeah,
dead. Who's next? How's that possibly going to go? And
yeah,
one thing I knew I could not do was drag a child kicking and screaming to the water's edge and assault them with a syringe full of ketamine. I wasn't definitely not prepared to do that. So I had to get them on board. And as we spoke about, what's my favourite part of anesthesia is gaining people's trust and instilling confidence. So I basically tried to put on my normal, 9 to 5 anaesthetics demeanour when I'm anaesthetising any child, and just have a bit of a laugh and make sure this was the most normal thing in the world for me to be doing. And I think that helped convince me as well as the kids that everything was going to be all right.
wow, yeah. It's interesting what you're saying. That I think like you're right. Like it's important to have like a toolbox with lots of different things in there. Like right, maybe we have moved away from the paternalistic style of medicine, but every once in a while we might have to pull that tool out, or lying to the kids. There can be a situation where what we typically view as unethical might actually be the right thing to do.
We
So
do deal
that's
with patients who are unable to, they've lost capacity for decision making. We
right.
can't find their relatives, and we've got minutes to make a decision. And we see that in critical
Yeah.
care medicine. And so at the end of the day, I think all we can do is make sure that we're comfortable in our own heart that we are doing the best possible thing for this patient at that moment. And if we're judged as having made a mistake later, well, that's what has to happen. But the only thing you can do in medicine is be true to yourself and your own values, and treat people as you'd want to be treated yourself. And that's the way I have practiced medicine in my career. I'm probably a bit old-fashioned in that I have avoided sometimes going into massive detail in risk explanations and consent, because there comes a point where I feel that actually the patient becomes frightened to the point of not being constructive. And, if I'm about to anesthetize someone with ischemic heart disease and I've made their pulse rate go up to 120 and their blood pressure up to 200, have I actually done the best thing for that patient as they're about to be induced for their
Right.
absolutely necessary cancer operation? So,
Right.
whilst it might make me safer medico-legally by doing that, in no way do I feel I've served that patient in the best possible way. So there's the right balance, I think, for every patient. Of course, if someone asks me a direct question, I will give them an honest answer. And of course, I always finish by saying, is there anything else you would like me to explain to you about the risks of what we're doing? But sometimes I feel like people don't want to necessarily know every tiny thing that could hurt them or happen to them, because they know they have to do it. So that's a
Yeah.
very individual perspective. In no way should anyone listening to this podcast take that as advice about informed consent, but just take the advice that do the best thing for your patient, not necessarily just to cover your own ass, I guess.
Yeah. Yeah. Very important point. Um, so, as physicians, we will often face, outcomes they're not great or they're not good, outcomes we didn't want. So, fortunately, this incident had such an excellent outcome, but how do you think it would have affected you if the outcome wasn't that great, if there would have been any sort of morbidity or mortality? How do you think it would affect you, and how would you have dealt with it?
Yeah, I think it would have been very difficult. Actually, my wife is far less naive and far more knowledgeable than I am in these things, and her major concern was for my mental health and my psychological well-being had this not worked out as it did. And I think that was pretty perceptive. I didn't even think about that before I went to Thailand. I just was very focused on, this job that I felt almost called to do because of this slightly unusual set of skills that I had. I really felt like this rescue just had my name all over it. So I didn't really consider any of the possible scenarios where this might not have a happy ending, for me at least. I was very aware of what might happen to the kids. And, I think she was very right in that I certainly wouldn't be here talking to you about it, Efrat, if all those children had died at my hands. And I think, the public, social media, the medical community all would have judged me very, very harshly had any of those children die. I mean, no one could ever judge us as harshly as we judge ourselves in medicine. I think that's the first thing I've learned. Any mistake or complication I've had or made in my career, I'm convinced that no one will judge me as harshly as I judge myself in those situations. And that comes back to being perfectionists and having a bit of OCD. We all want to be perfect at our jobs, but medicine's not like that. It is unforgiving, and we all make mistakes, and we all have bad outcomes. That's just an unescapable fact, and we need to learn to be kinder to each other when that happens, because I don't think we're very good at that either. Sorry, I've digressed again, but just another one of my hobby horses. So yeah, it would have been hard to deal with, and I think social media, especially, it is the Monday morning quarterbacks would have been out in force. Immediately after I did this, I had a few, not colleagues known to me, but professionals from around the world sort of just hinting at criticism about what I'd done and the technique I'd used and the drugs and so on and so forth. And I'm going, well, I'm very open to suggestions how you think it could have been done better. But, fortunately it had 100% positive outcome. So just imagine if it hadn't, what that would have been like. It would have been very fraught.
Yeah. Wow. Well, I'm glad you had your wife to help support you through that. That kind of leads me to the next question. Did you have, who was your support network during the rescue? Who are the people that were giving you the encouragement, that were there for you, or maybe not? Maybe it was a time in your life where you felt you really needed to turn inwards and sort of, keep everyone else at bay and do your own thing. Can you talk about that?
Yeah, I mean, I felt I came up with the plan for the anesthesia by myself, but I thought I better just run this by a few other people. And then I thought, well, who do I ring? Who do I ask? What would you do?
Who has rescued people from a cave by anesthetizing them in the last century?
So I honestly was struggling to think of someone who might know more about it than I do. And I know that sounds very arrogant, but honestly, who do you call? And so I rang a friend of mine who's actually he's like the MacGyver of medicine. He's just a guy who I respect enormously. He has done pretty much everything in medicine, including working in Antarctica for two years or more. So the most remote medical service in the world, working entirely by yourself, doing your own dentistry, obstetrics, surgery, anesthesia, whatever has to be done, you're the guy who has to do it. And you've got some tradesmen around you who can kind of hold things and help, but that's it. And this guy's got enormous experience in so many different spaces in medicine, including critical care. And so I rang him up and I said, this is my situation and this is what I'm planning. And he went, yep, happy with that. Carry on. Excellent. Thank you.
It's like when I call my attending, when I text my attending the night before, here's my plan, and they're like, check.
Yeah, exactly. And I don't know what I was hoping for, some pearl of wisdom, but really there were none. And I did touch base with a couple of other people with the same response. And then when I was in Thailand, of course, the Thais, not knowing anything about me, very rightly wanted to know if I was the right guy for this job, and even if I was actually a doctor or whether I was just a cave diver with a stethoscope around my neck. And so I got interrogated by a professor of psychiatry, a pediatric anesthesiologist from Bangkok, and the Thai medical people themselves. And they were all, it was like a pretty hardcore job interview, to be honest. And I kept saying, look, I'm very open to suggestions. If you've got any better ideas, please let me know. This has never been done before. This is just my best guess. And none of them had any suggestions. So I felt that at least I'd done my due diligence and make sure there wasn't another expert out there who had a better idea or something obvious that I'd missed.
So it sounds like you were basically the one who stepped up with this plan, but you had a support network around you, who were
Yeah,
there for you. And
yeah, I think so. I mean, I had enough people at home, to talk to, check in with each night when I was back in my hotel, including my wife, obviously most important to me, to just touch base with her and let her know that I was safe, actually, at the end of each day. That was her obvious main worry. Although she said she was never too concerned for my physical well-being in the cave because, she's been worrying about that for far too many years to really think that this cave would be anything
she's over
different.
that.
Yeah, so she's kind of stopped worrying about that, but she was certainly worried about, how I would be coping with it all. And in Thailand itself, we had an amazing team around us. We had the American Air Force was there, who were extraordinary. A group of them called the PJs, or Pararescue Team, who are like, super duper paramedics who work with the special forces. They are very, very awesome guys and girls. And Australian Federal Police and lots of embassy people and government people from Australia hanging around, keeping an eye on us, keeping us out of trouble. So I did feel well supported in all of this.
Yeah, that's great. Making sure you're not just a cave diver with a stethoscope around your neck,
Exactly.
basically.
Yes.
Wow. Can you tell us a little bit about the projects you're currently working on?
Well, life has changed very dramatically for me since June, July 2018. As I mentioned, we didn't quite realize the size of this story around the planet. And when we landed back in Australia, it was like, it's very hard to describe what happened. There was just this fascination by the media and the population to find out what these two Australian blokes had been doing over in Thailand. And by then the story was very big news. And the kids, one by one, they all came out of the cave. Everyone was watching glued to the television. And we came home just blissfully ignorant of what was about to happen to us. But, it was life-changing. And the media, of which I've been always suspicious and very nervous about, were very, very keen to talk to us. And so initially we hid away from that, but it became very, very difficult to do that, especially once we were given some recognition by the government, and finally ended up being the Joint Australians of the Year in 2019, which in Australia is a very big award usually for services to something far more long-lasting or significant than cave diving in Thailand, but people who have cured cancer or saved the world, basically that sort of stuff. And then we're suddenly in this group of people, and we were very, very humbled and slightly worried about what our message was going to be, moving forward after that, because you're supposed to come to that with some incredible social platform or other goodness. So that's when I started to think a lot about this stuff about adolescent mental health and sensible risk taking and getting kids off their screens and outdoors to try and look after their mental health while they're going through that difficult period of life and beyond. So it's been extraordinary, and it has given me a lot of different opportunities. I've been doing a lot of speaking, I've been writing. I've done some books like this kids book, Alfie, over my shoulder there. So I'm writing kids books now.
Is it on Amazon? Is it on Amazon?
Yeah, it would be. Yeah, Alfie the Brave. Alfie the Brave, it's called.
What age is it for? Just
if
it's
for
something
that you would read to small kids. I think it's a picture book.
Yeah. Okay, my kids are small. So.
Perfect. And really, it carries on with that theme about not everyone's brave. Like my little dog, who's a real guy, by the way, Alfie. He's frightened of everything, but he looks like a tough little bloke, little Staffordshire Bull Terrier. So he's supposed to be tough, but he's frightened of the whole world. And isn't that like all of us, really? We're all scared of something. So Alfie finds his courage in the end. And for me, it was, my life had been something that I'd just been living, I think, and then I suddenly realised through this rescue that everything I had done had finally kind of found a purpose, and so it was an eye-opening moment for me. It was an amazing opportunity for me to reconsider my values and what I was doing with my life. So now I do a heap of charity work and all sorts of stuff. It's been brilliant.
Wow, that's incredible. Gonna scout that book out for my little
Yeah, you must.
girls.
One more copy could make me rich.
So our last question, I'm a little sad that this interview is ending, but we have to end it at some point. What advice do you want to leave our pre-med and medical students, and actually, frankly, anybody else listening to this podcast? What advice do you want to leave them with?
Um, well, that's a big question, but I think I've already said all the stuff that I strongly believe in. And for some people, medicine is their life, it is their world, it is their passion. They would rather do that than anything else in their spare time. And for those people, that's great and enjoy it. But for most people, I feel like we do need a balance. And I know from what I know about working in the US and in Australia, people sometimes frown upon others that actually have a life outside of medicine. But this issue of burnout and significant mental health problems, especially in anesthesia for some strange reason, is a really genuine one. And you do need to make time for yourself, to have time with your loved ones and time for yourself. Just do that thing, whatever it is in your life that helps you relax and find mindfulness and a bit of time away from that job and that thing that we're all so caught up in. Don't ever think that you shouldn't take a regular afternoon off if you of seniority that allows you to do that. Because that afternoon off is actually more valuable than the other 4.5 days or however many days they make you work over there. To look after yourself and actually make you a better doctor and a better person, and throw yourself at any other life opportunities that come your way, including in medicine. So, for me, working in third world countries, working in different countries as often as possible, different systems, has been really, really important for me to become much more rounded as a clinician, I think. So have more fun, do less work. You're allowed to say that on a medical podcast?
Oh, absolutely. Well, that's part of why JOMA exists, right? So we have networking events and, fun things. And I think your message is like perfect. And something that much as we know it, we need to hear it. We need to hear it a couple of times till it really sinks in.
Good. I mean, you may have ended up talking to the world's laziest doctor, but as I say, I've done all right in the end.
You certainly have. Dr. Harris, this interview has been incredible. Thank you so much for your time. I really enjoyed this, and I hope we meet again at some point.
I hope so. Thanks, Efrat.
Thanks for listening to the JOMA Preventative Health Podcast. If you've enjoyed this, please rate and review us on Apple Podcasts and share this with your friends. For more information, check out our Instagram at JOMA_org. Check out our website, www.joma.org, that's JOWMA.org, or email us at health@joma.org.